So I'm here with Norman, our golden retriever patient today, and my clinical mentor, Dr. Jones, and we're going to be doing a Saphenous catheter placement. So I'm going to be using this leg of Norman's, and we've got to do a little bit of a hair clip. So it's always best to see if you can feel it first. Can you apply some pressure and act as a tourniquet here for me? Let's see if we can have an idea of where it is. So we don't have to cut too much of your beautiful hair. Okay, Norman. Okay, I think it's about there. So we're going to cut his hair right here. Yep, and it's standing up really well for us right there. You just put a little bit more down here, so we're not having any hair come into our sterile site when we have prepped it. And then we also want to make sure we trim a little bit of this really long hair along the side so it can't come in. You just trim it up for him. Like so. I can do a little bit here as well. That way we can be sure that we're not going to have any of that hair come into our site. I'm going to do a little bit more right here. Okay, so we should be pretty good there. So now what we need to do is we're going to need to do our prep. So for our prep here, I'm going to have to make sure that for our gauze, I fold them like this, and then I get chlorhexidine on them. And we're going to start with a target technique. So I want to make sure that I start from where I'm going to be going in, like this, and go up and around, rotating my gauze so that it's always facing upwards. Now I should do that 3 more times. That was just to clean the leg up superficially. And now I just want to make sure that I take a few more gauze pieces and repeat the same process. We want to make sure that our gauze, this side is always touching the hair, and that the inside there is always touching where we're going to be going and poking. You can see that Norman's got long hair. It's okay to wet the hair as you go around there as well, if it's going to help for the hair to not come into your surgical site, or in this case, your catheter site. I'm just going to wet his hair down here. It stays down. And then one more time. And then we can move on to his final paint. Go. And I'm just going to take a little bit more chlorhexidine here, and I'm going to go from the outside and up, just pushing that hair away. So I didn't contaminate the site here at all because I was only touching from here up, just making sure that it's completely out of the way. We need to do this with alcohol for a final pee. okay to use two hands if you need to. Most important thing is that the gauze in this inside is always facing the inside, and that outside is always facing the outside, and that your hand does not touch the site. Okay, now Norman is all prepped.